Have you ever woken up feeling like you've wrestled a badger in your sleep, every muscle protesting even the simplest act of reaching for your morning coffee? Or perhaps you found yourself staring blankly into the refrigerator, the once familiar contents now a baffling landscape you can't quite navigate. Maybe you've dismissed that fleeting dizziness as just standing up too fast, or that persistent cough as merely a tickle in your throat. You've probably even attributed that newfound inability to recall your neighbor's name to just one of those senior moments, haven't you? Well, while some of these experiences might indeed be fleeting inconveniences, the human body, especially one that's gracefully accumulated 7 decades or more of stories, whispers its truths in subtle ways. Ignore these whispers, chalk them up to the inevitable aches and indignities of aging, and you probably won't survive this decade with the vitality and independence you deserve. The choice to stop surviving and start living again. And if you're still with me, still listening, still open, I thank you. Because the elderly who change their lives are the ones who first find the courage to listen. You've just taken the first step. Now take the next one. If this message spoke to you, if even one part of it made you pause, reflect, or feel seen, I'd be honored if you'd let me know. Now, let's talk about that feeling of being perpetually drained, that heavy cloak of fatigue that settles over you even after a seemingly restful night. It's easy to brush this off. Of course I'm tired, I'm not as young as I used to be, you might say. And while it's true that energy levels can naturally fluctuate with age, a persistent and unexplained exhaustion is not a standard feature of growing older. It's a red flag, a subtle signal your body might be sending about something deeper going on. Think about it, is this a new kind of tiredness, different from the weariness after a long day of gardening or playing with the grandchildren? Does it linger for days, even weeks, despite adequate rest? Does it come on suddenly, leaving you feeling utterly depleted without a clear reason? These are crucial distinctions. This isn't about the occasional slump we all experience. This is about a pervasive lack of energy that interferes with your daily life, making it difficult to enjoy your usual activities, pursue your hobbies, or even manage basic tasks. It could manifest as an overwhelming need to nap multiple times a day, a struggle to concentrate, or a general feeling of malaise that just won't lift. Sometimes, this fatigue can be accompanied by other subtle symptoms, like feeling cold even when the room is warm, or experiencing a noticeable shortness of breath with minimal exertion. These seemingly minor clues can paint a bigger picture. What could be the underlying cause of this persistent fatigue? Well, the possibilities are varied. It could be a sign of an underlying medical condition, such as anemia, where your body isn't producing enough red blood cells to carry oxygen effectively. It could be related to thyroid issues, either an underactive or overactive thyroid gland disrupting your metabolism. Heart problems can also manifest as fatigue, as your heart struggles to pump blood efficiently. Even something as seemingly common as undiagnosed diabetes can lead to persistent tiredness due to fluctuations in blood sugar levels. And let's not forget the impact of mental health. Conditions like depression and anxiety can often present with profound fatigue. Ignoring this subtle signal of persistent fatigue can have significant consequences. If the underlying cause is a medical condition, delaying diagnosis and treatment can allow the problem to worsen, potentially leading to more serious health complications down the line. For instance, untreated anemia can lead to heart problems, and undiagnosed diabetes can damage vital organs. Furthermore, chronic fatigue can significantly impact your quality of life, limiting your ability to engage in activities you enjoy, maintain social connections, and live independently. It can contribute to feelings of frustration, isolation, and even depression, creating a vicious cycle of low energy and low mood. So, what should you do if you find yourself experiencing this kind of persistent, unexplained fatigue? The first and most important step is to talk to your doctor. Be prepared to describe the nature of your fatigue in detail, when it started, how it makes you feel, what seems to make it better or worse, and any other symptoms you might be experiencing alongside it. Your doctor can then conduct a thorough evaluation, which may include blood tests, a physical examination, and questions about your medical history and lifestyle. Based on this assessment, they can identify any underlying medical conditions and recommend appropriate treatment. This might involve medication, lifestyle changes, or referrals to specialists. Remember, listening to this subtle signal and seeking timely medical attention can make a significant difference in managing your health and maintaining your vitality as you continue to age gracefully. It's about empowering yourself with knowledge and taking proactive steps to ensure your well-being. Now, let's shift our focus to another subtle yet significant health sign: unexpected changes in your weight. Just like that persistent fatigue we discussed, fluctuations on the scale that aren't tied to intentional dietary changes or exercise routines shouldn't be dismissed as simply getting older. Whether you find yourself suddenly shedding pounds without trying or noticing a gradual but steady increase in weight despite no significant alterations in your eating habits, these shifts can be your body's way of communicating that something is amiss. Let's first consider unintentional weight loss. It might seem appealing on the surface. Who wouldn't want to lose a few pounds effortlessly? However, significant and unplanned weight loss in older adults can be a red flag for various underlying health conditions. We're not talking about losing a pound or two after a bout of the flu. We're talking about a noticeable and sustained decrease in weight over weeks or months without any conscious effort on your part. This kind of weight loss can be a sign of several potential issues. For instance, certain cancers can lead to unexplained weight loss as the body's metabolism changes and the disease consumes energy. Conditions affecting the digestive system, such as malabsorption issues or inflammatory bowel disease, can also hinder nutrient absorption, leading to weight loss. Hyperthyroidism, an overactive thyroid gland, can rev up your metabolism to an unhealthy degree, causing you to lose weight even if you're eating normally. Even seemingly less serious conditions like chronic infections or dental problems that make eating difficult can contribute to unintentional weight loss. Furthermore, mental health conditions like depression can sometimes manifest as a loss of appetite and subsequent weight loss. On the other side of the coin, unexpected weight gain, particularly if it's gradual and not linked to changes in your diet or activity levels, also warrants attention. While it's true that metabolism can slow down slightly with age, significant weight gain shouldn't be considered an inevitable part of growing older. It can be a symptom of several underlying health problems. For example, hypothyroidism, an underactive thyroid gland, can slow down your metabolism, leading to weight gain even if you haven't increased your food intake. Heart failure can cause fluid retention, which can manifest as a sudden increase in weight and swelling in the legs or abdomen. Kidney problems can also lead to fluid buildup and weight gain. Certain medications, such as steroids or some antidepressants, can also have weight gain as a side effect. Additionally, conditions like Cushing's syndrome, a hormonal disorder, can cause weight gain, particularly around the abdomen and face. Ignoring these unexpected weight changes, whether it's loss or gain, can have serious consequences. If the underlying cause is a serious medical condition like cancer, early detection and treatment are crucial for improving outcomes. Delaying diagnosis can allow the disease to progress, making treatment more challenging. Similarly, if the weight change is a symptom of a heart or kidney problem, failing to address it can lead to further complications and a decline in overall health. Even if the cause is less immediately life-threatening, such as thyroid issues, leaving it untreated can significantly impact your energy levels, mood, and overall well-being. So, what should you do if you notice significant and unexplained changes in your weight? The first step, as with any concerning health sign, is to consult your doctor. Keep track of any weight fluctuations you observe, noting when they started and how much weight you've lost or gained. Be prepared to discuss your eating habits, activity levels, and any other symptoms you might be experiencing. Your doctor will likely perform a physical examination and may order blood tests or other investigations to determine the underlying cause of your weight change. Depending on the diagnosis, they can recommend appropriate treatment, which might involve dietary changes, exercise recommendations, medication, or referrals to specialists. Remember, paying attention to these subtle shifts in your weight and seeking timely medical advice can be a crucial step in maintaining your health and addressing any potential underlying issues early on. It's about being an active participant in your own well-being and recognizing that your body's signals, even seemingly minor ones, deserve your attention. Let's now turn our attention to another often underestimated health indicator: persistent sleep disturbances. We all experience the occasional restless night, the tossing and turning that leaves us feeling groggy the next day. However, when sleep problems become a regular occurrence, whether it's chronic insomnia making it difficult to fall or stay asleep, or excessive daytime sleepiness despite seemingly adequate time in bed, it's a subtle sign that shouldn't be ignored, especially as you move through your 7th decade and beyond. These persistent disruptions in your sleep patterns can be indicative of underlying health issues that require attention. Consider the experience of chronic insomnia. It's more than just a few nights of poor sleep. It's a pattern of difficulty falling asleep, staying asleep, or waking up too early and being unable to fall back asleep, occurring several times a week for an extended period. This can leave you feeling constantly fatigued, irritable, and struggling to concentrate during the day, as we discussed in the first section. But the implications of chronic insomnia go beyond just feeling tired. It can be a symptom of underlying medical conditions such as chronic pain, restless leg syndrome, sleep apnea, or even certain cardiovascular problems. Hormonal changes, particularly in women, can also contribute to sleep disturbances. Furthermore, mental health conditions like anxiety and depression are often closely linked to insomnia, creating a challenging cycle where poor sleep exacerbates mental health issues, and vice versa. On the other hand, excessive daytime sleepiness, or hypersomnia, is another sleep-related issue that shouldn't be dismissed as simply needing more rest. While it's natural to feel a bit more tired as you age, constantly feeling the urge to nap during the day, struggling to stay awake during normal activities, or feeling unrefreshed even after long hours of sleep can point to underlying problems. One significant cause of daytime sleepiness, particularly in older adults, is sleep apnea, a condition characterized by repeated pauses in breathing during sleep. These pauses disrupt sleep quality, leading to daytime fatigue. Other medical conditions, such as narcolepsy, certain neurological disorders, and even some medications, can also contribute to excessive daytime sleepiness. Ignoring persistent sleep disturbances, whether it's insomnia or excessive sleepiness, can have a significant impact on your overall health and well-being. Chronic sleep deprivation can weaken your immune system, making you more susceptible to infections. It can impair cognitive function, affecting your memory, concentration, and decision-making abilities. It can also increase your risk of falls and accidents due to decreased alertness and coordination. Furthermore, as mentioned earlier, poor sleep can worsen existing mental health conditions and even contribute to the development of new ones. In the long term, chronic sleep problems have been linked to an increased risk of developing more serious health issues, such as cardiovascular disease and diabetes. So, what should you do if you find yourself consistently struggling with sleep, either unable to get enough restful sleep at night or feeling excessively tired during the day? The first crucial step is to discuss these issues with your doctor. Keep a sleep diary for a week or two, noting down the times you go to bed, how long it takes you to fall asleep, how many times you wake up during the night, when you wake up in the morning, and how you feel during the day. This information can be invaluable for your doctor in assessing your sleep patterns. They may ask about your lifestyle, including your diet, exercise habits, and medication use. In some cases, your doctor might recommend a sleep study, also known as polysomnography, which is a non-invasive test that monitors your brain waves, heart rate, breathing, and oxygen levels while you sleep. This can help diagnose conditions like sleep apnea. Based on the evaluation, your doctor can recommend appropriate treatment, which might include lifestyle modifications such as establishing a regular sleep schedule, creating a relaxing bedtime routine, optimizing your sleep environment, and avoiding caffeine and alcohol before bed. In some cases, medication or therapies like cognitive behavioral therapy for insomnia, CBTI, might be recommended. Addressing persistent sleep disturbances is not just about feeling more rested, it's about safeguarding your physical and cognitive health and improving your overall quality of life as you continue to age. Listening to these subtle signals your body is sending and seeking appropriate help can make a profound difference in your daily well-being and long-term health. Now, let's focus on a set of subtle health signs that are often right in front of us, literally on our surface: changes in the appearance of your skin. While wrinkles and the occasional age spot are generally considered normal parts of aging, certain new developments or alterations in your skin's condition can be important indicators of underlying health issues that shouldn't be overlooked. Paying attention to these visual cues can provide valuable insights into your overall well-being. One area to be particularly vigilant about is the appearance of new moles or changes in existing ones. Most moles are harmless, but some can develop into melanoma, a serious form of skin cancer. Keep an eye out for moles that are asymmetrical, the two halves don't match, have irregular borders, exhibit variations in color, have a diameter larger than a pencil eraser, or are evolving in size, shape, or color. Any new mole that appears suddenly, bleeds, itches, or feels different from your other moles should also be checked by a dermatologist. Regular self-exams of your skin, ideally once a month, can help you detect these changes early. Remember that crocodile dung sunscreen you, hopefully didn't, use back in the day. Modern sun protection is crucial, especially as you age and your skin becomes more susceptible to sun damage, which is a major risk factor for skin cancer. Beyond moles, other changes in your skin's appearance can also be significant. The sudden onset of a persistent rash, especially if it's accompanied by itching, pain, or fever, could indicate an allergic reaction, an infection, or even an autoimmune condition. For instance, shingles, a reactivation of the chickenpox virus, often presents as a painful blistering rash on one side of the body. Eczema and psoriasis, chronic inflammatory skin conditions, can flare up and cause itchy, red, scaly patches. Certain systemic diseases, like lupus, can also have skin manifestations, such as a butterfly-shaped rash across the face. Another subtle skin change to watch out for is persistent dryness or excessive itching. While dry skin can be a common issue, particularly in older adults due to decreased oil production, severe or persistent dryness that doesn't improve with moisturizers could be a sign of an underlying medical condition, such as diabetes or kidney disease. Similarly, unexplained, persistent itching, even without a visible rash, can sometimes be a symptom of liver disease, kidney disease, or certain types of cancer. Changes in skin color can also be telling. Jaundice, a yellowing of the skin and whites of the eyes, is a classic sign of liver problems. Paleness, or a loss of color in the skin, can indicate anemia. A bluish tint to the skin, particularly around the lips and fingertips, cyanosis, can suggest a problem with oxygen circulation, possibly related to heart or lung issues. Ignoring these changes in your skin's appearance can delay the diagnosis and treatment of potentially serious underlying conditions. Skin cancer, if detected early, is often highly treatable. However, if left untreated, it can spread to other parts of the body and become life-threatening. Similarly, skin manifestations of other diseases can provide crucial clues for early diagnosis and management, improving overall health outcomes. Therefore, it's essential to pay attention to your skin and be aware of any new or changing features. Make it a habit to examine your skin regularly, looking for any unusual moles, rashes, dryness, itching, or color changes. If you notice anything concerning, don't hesitate to consult your doctor or a dermatologist. They can perform a thorough examination, and if necessary, conduct biopsies or other tests to determine the cause of the skin changes. Remember, your skin is the largest organ in your body and often reflects what's happening internally. Being vigilant about these subtle visual cues can be a proactive step in safeguarding your health and well-being as you continue to age. It's about recognizing that even seemingly superficial changes can hold important information about your overall health. Now, let's delve into a realm of subtle health signs that can often be dismissed as just a part of getting older or the result of something you ate: digestive issues. While occasional heartburn, a bit of bloating after a large meal, or a minor change in bowel habits might not be cause for immediate alarm, persistent or significant alterations in your digestive function should not be ignored, especially as you age. These seemingly common complaints can be your body's way of signaling underlying health concerns that warrant investigation. Let's start with persistent heartburn or acid reflux. Occasional heartburn after a spicy meal is one thing, but frequent or severe heartburn that occurs multiple times a week, even without obvious triggers, can be a sign of gastroesophageal reflux disease, GERD. GERD can lead to inflammation of the esophagus, causing discomfort and potentially increasing the risk of more serious complications over time. It's also important to differentiate heartburn from other types of chest pain, as chest pain can sometimes be a symptom of heart problems. If your heartburn is accompanied by chest pain, shortness of breath, or dizziness, it's crucial to seek immediate medical attention. Another digestive issue that deserves attention is persistent bloating or abdominal discomfort. Feeling full or bloated after a large meal is normal, but if you experience frequent and uncomfortable bloating, even after eating relatively small amounts of food, it could indicate a problem. This could be related to increased gas production, fluid retention, or even issues with the way your digestive system is processing food. In some cases, persistent bloating can be a symptom of irritable bowel syndrome, IBS, small intestinal bacterial overgrowth, SIBO, or even more serious conditions like ovarian cancer in women. Changes in bowel habits are another area where subtle shifts can be significant. While occasional constipation or diarrhea can happen to anyone, persistent changes in the frequency, consistency, or color of your stool should not be ignored. For example, persistent constipation that doesn't respond to dietary changes or over-the-counter remedies could indicate a more serious underlying issue, such as a bowel obstruction or even colorectal cancer. Similarly, persistent diarrhea can lead to dehydration and electrolyte imbalances and could be a sign of an infection, inflammatory bowel disease, or malabsorption problems. The appearance of blood in your stool, whether bright red or dark and tarry, is always a serious symptom that requires immediate medical attention. Furthermore, unexplained nausea or vomiting, especially if it's persistent or severe, is another digestive sign that shouldn't be dismissed. While it can be caused by a temporary stomach bug, persistent nausea and vomiting can also be symptoms of more serious conditions, including medication side effects, food intolerances, gallbladder problems, or even neurological issues. Ignoring these persistent digestive issues can have significant consequences. Untreated GERD can lead to esophageal damage and increase the risk of esophageal cancer. Chronic digestive problems can significantly impact your quality of life, causing discomfort, pain, and limiting your ability to eat and enjoy food. More serious underlying conditions, such as colorectal cancer, can have much better outcomes if detected and treated early. Therefore, it's important to pay attention to your digestive health and be aware of any persistent or significant changes in your normal patterns. Keep track of your symptoms, noting when they occur, how often, and what seems to trigger or relieve them. Don't hesitate to discuss any concerns with your doctor. They can ask you detailed questions about your symptoms, perform a physical examination, and may recommend further investigations, such as blood tests, stool tests, endoscopy, or colonoscopy, depending on your specific situation. Lifestyle modifications, dietary changes, and medications can often help manage many digestive issues. Recognizing and addressing these subtle digestive signs can lead to earlier diagnosis and treatment of underlying conditions, ultimately improving your comfort and overall health as you continue to age. It's about acknowledging that your gut health plays a crucial role in your overall well-being and that persistent digestive issues are your body's way of asking for attention. Let's now turn our attention to a more internal and often overlooked category of subtle health signs: shifts in your mood and cognition. While experiencing occasional sadness or forgetfulness can be a normal part of life, particularly as we navigate the complexities of aging, significant or persistent changes in your emotional state or cognitive abilities should not be dismissed as simply getting old or just feeling down. These subtle shifts can be indicators of underlying physical or mental health conditions that warrant careful consideration and attention. Consider subtle changes in your mood. Feeling a bit more irritable than usual, experiencing increased anxiety without a clear trigger, or noticing a persistent low mood that lingers for weeks or even months are not necessarily just signs of a bad day. These could be early indicators of a developing mood disorder like depression or anxiety. In older adults, depression can sometimes present differently than in younger individuals, often manifesting as fatigue, loss of interest in activities you once enjoyed, changes in appetite or sleep patterns, as we discussed earlier, or even physical symptoms like unexplained aches and pains. Similarly, increased anxiety can manifest as excessive worry, restlessness, difficulty concentrating, or physical symptoms like rapid heartbeat or muscle tension. It's important to recognize that these mood changes are not just a matter of snapping out of it, they can be signs of a genuine medical condition that can significantly impact your quality of life and overall well-being. Subtle shifts in your cognitive abilities also deserve careful attention. We all have moments where we misplace our keys or forget a name, and these occurrences can become slightly more frequent with age. However, noticing a more significant decline in your memory, such as difficulty remembering recent conversations or events, struggling to follow familiar instructions, getting lost in familiar places, or experiencing increased confusion about time or place, should not be ignored. These could be early signs of mild cognitive impairment, MCI, or even dementia, such as Alzheimer's disease. While not all individuals with MCI will go on to develop dementia, it's important to have these changes evaluated by a healthcare professional to determine the underlying cause and explore potential interventions or support. Furthermore, subtle changes in personality or behavior can also be indicative of underlying issues. For example, a noticeable increase in agitation, withdrawal from social activities, or a significant shift in your usual demeanor could be signs of cognitive decline or a mood disorder. Even subtle difficulties with language, such as trouble finding the right words or understanding conversations, can be early indicators of cognitive problems. Ignoring these subtle shifts in mood and cognition can have significant consequences. Untreated mood disorders like depression and anxiety can severely impact your quality of life, leading to social isolation, decreased engagement in activities, and even an increased risk of physical health problems. Early detection and management of cognitive decline can allow for interventions and support that can help maintain function and independence for longer. It also allows individuals and their families to plan for the future. Therefore, it's crucial to be aware of these subtle internal changes and to communicate any concerns you might have to your doctor. Don't dismiss these feelings or experiences as just part of getting old. Be prepared to describe the specific changes you've noticed, when they started, and how they are impacting your daily life. It can be helpful to involve a trusted family member or friend who can also provide observations. Your doctor can perform cognitive assessments, mood screenings, and may order blood tests or brain imaging to help determine the underlying cause of these changes. Depending on the diagnosis, treatment options might include therapy, medication, lifestyle modifications, or referrals to specialists such as neurologists or psychiatrists. Recognizing and addressing these subtle shifts in your mood and cognition is a proactive step in maintaining your mental and emotional well-being and ensuring the best possible quality of life as you continue to age. It's about acknowledging that your mental health is just as important as your physical health and that subtle changes in your inner world deserve your attention and care. Finally, let's discuss a category of subtle health signs that many tend to downplay or attribute to the normal wear and tear of aging: lingering minor aches and pains. While the occasional twinge or stiffness after physical activity is common, persistent or worsening discomfort, even if it seems relatively minor, can be a subtle signal from your body that shouldn't be ignored, especially as you navigate your later years. These seemingly insignificant aches and pains can sometimes indicate underlying musculoskeletal issues, inflammatory conditions, or even more serious problems. Think about that persistent stiffness in your joints that you've just been living with. Or that nagging back pain that you attribute to sleeping in the wrong position. Maybe it's that recurring ache in your knee that flares up whenever you take a walk. While it's easy to dismiss these as just the consequences of years of activity, these lingering discomforts can be early signs of conditions like osteoarthritis, rheumatoid arthritis, or other musculoskeletal disorders. Osteoarthritis, the most common form of arthritis, involves the breakdown of cartilage in your joints, leading to pain, stiffness, and swelling. Rheumatoid arthritis is an autoimmune disease that causes inflammation of the joints, often affecting multiple joints symmetrically. Ignoring these early symptoms can lead to progressive joint damage, decreased mobility, and a significant impact on your ability to perform daily activities and maintain your independence. Similarly, persistent muscle aches or tenderness that aren't related to recent exertion could indicate other underlying issues. For example, fibromyalgia is a condition characterized by widespread musculoskeletal pain accompanied by fatigue, sleep problems, and mood issues. Polymyalgia rheumatica is an inflammatory disorder that causes pain and stiffness in the shoulders, neck, hips, and thighs, and it's more common in older adults. Even seemingly minor, localized pain that doesn't go away could be a sign of a nerve issue or a developing soft tissue injury. Furthermore, it's important to pay attention to any new or unusual types of pain. For instance, persistent headaches that are different from your usual tension headaches, especially if they are severe or accompanied by other symptoms like vision changes or nausea, could be a sign of a more serious underlying condition. Chest pain, as mentioned earlier in the context of heartburn, should always be taken seriously as it can be a symptom of heart problems. Even unexplained pain in the abdomen, back, or flank could indicate issues with internal organs like the kidneys or gallbladder. Ignoring these lingering minor aches and pains can have several consequences. Firstly, if the underlying cause is a progressive condition like arthritis, delaying diagnosis and treatment can allow the condition to worsen, leading to more severe pain and disability. Early intervention, through medication, physical therapy, and lifestyle modifications, can often help manage pain and slow down the progression of these conditions. Secondly, persistent pain can significantly impact your quality of life, limiting your ability to engage in activities you enjoy, affecting your sleep, and contributing to feelings of frustration and even depression. Finally, dismissing new or unusual pain as just a minor inconvenience could delay the diagnosis of a more serious underlying medical condition that requires prompt attention. Therefore, it's important to be mindful of any persistent or worsening aches and pains, even if they seem relatively minor. Don't just chalk them up to getting older without further consideration. Pay attention to the location, intensity, and duration of the pain, as well as any other accompanying symptoms. If the pain is persistent, worsening, or interfering with your daily activities, it's essential to discuss it with your doctor. They can perform a physical examination, assess your range of motion, and may recommend imaging tests like X-rays or MRIs to evaluate the underlying structures. Based on their assessment, they can recommend appropriate treatment, which might include pain relievers, anti-inflammatory medications, physical therapy, occupational therapy, or even referral to a specialist. Listening to these subtle signals of lingering discomfort and seeking timely medical attention can be a crucial step in managing pain, maintaining your mobility, and preserving your quality of life as you continue to age. It's about recognizing that even seemingly minor aches and pains can be your body's way of asking for support and care. Have you ever sat quietly, perhaps in your favorite armchair, the afternoon sun casting long shadows across the room, and felt a profound sense of peace settle over you? The frantic pace of earlier years has softened, replaced by a gentle rhythm of days. You might find yourself savoring the warmth of a cup of tea, the delicate fragrance of a blooming flower, the comforting familiarity of a well-worn photograph. These are the moments when the subtle beauty of life often reveals itself, when the whispers of your own body become clearer if you take the time to listen. The journey of aging is a unique and personal one, filled with both challenges and profound joys. It's a time for reflection, for appreciating the tapestry of experiences that have woven the fabric of your life. It's also a time to honor the incredible resilience of your body, a vessel that has carried you through decades of triumphs and tribulations. And as this remarkable vessel continues its journey, it communicates its needs in ways that are often gentle, subtle, almost like a soft murmur in a crowded room. By taking the time to truly listen to these whispers, the persistent fatigue, the unexpected weight changes, the disrupted sleep, the alterations on your skin, the changes in your digestion, the subtle shifts in your mood and cognition, the lingering aches and pains, you are not just addressing potential health concerns. You are engaging in a deeper conversation with yourself, a conversation rooted in self-awareness and self-care. You are acknowledging the wisdom of your body, respecting its signals, and actively participating in your own well-being. And as you cultivate this mindful awareness, this gentle attentiveness to the subtle language of your body, you may find a new sense of vitality emerging. A renewed appreciation for each day, a deeper connection to your inner self, and a quiet confidence in your ability to navigate the years ahead with grace and strength. The path to living healthier and longer is not about chasing an elusive fountain of youth, it's about embracing the present moment, honoring your body's wisdom, and making conscious choices that support your overall well-being. It's about slowing down, tuning in, and allowing the gentle whispers of your body to guide you towards a life lived fully, with both strength and serenity.